All right, welcome to this wonderful live. My name is Dr. Ashvin Sood. I'm a child and adolescent psychiatrist here at the SSM Health Treffert Studios. Board certified child and adolescent psychiatrist, adult psychiatrist, and overall therapist, helping people manage feelings of depression, anxiety. And today's podcast is hosted with the wonderful That Psych NP, who I'm about to invite.
Hello, can you hear me and see me?
I can hear you. I'm going to turn your volume up just a little bit. There we go.
All right. Perfect. And hopefully I have everything right here. I am hiding in the bedroom, so I think I'm good to go.
Excellent. I am so excited and stoked to have you here. I'll do a brief introduction just to get everybody oriented. Welcome to Divergent Minds. Divergent Minds is a podcast that we post typically on Facebook Live, but we are a mental health studio in Fond du Lac, Wisconsin, that helps people out, both neurodivergent youth and adults, working with psychiatric illnesses, disorders, and just establishing a good kind of strength-based approach with each case. Dr. Chapman, who is one of my colleagues and the behavioral director there, and I kind of came up with this podcast because we're both in social media, and we were like, hey, let's work and get some amazing mental health content creators as well to kind of get their expertise and their thoughts, and your name came up. So yeah, I'd like to introduce you. You're Laura, a licensed clinical social worker, as well as a a psychiatric, board certified psychiatric nurse practitioner, if I'm not mistaken.
Yeah,
And
that's correct.
an incredible social media influencer as well. Over almost 400,000 followers. We look up to people like you and what you do. And so just wanted to introduce you and welcome you to the show.
Thank you very much. And I was honored to be invited on. Seriously, I'm touched, seriously.
Of course. I mean, I think you and I have been following each other for quite some time through Mind Media Psych, and that'll slowly kind of turn over here. But the whole aspect of it is that we're mental health content creators on TikTok. And I wanted to invite you today because you have a particular kind of audience you talk to, or just like kind of explain. And I am not familiar exactly with the differences in the ages and everything. So I think maybe we can start there. Like maybe we'll start first with what brought you to TikTok and talking about mental health, and we can kind of then get into kind of your expertise there.
Sure. So in terms of what brought me to TikTok, my sister, who's an LCSW as well, she would like randomly send me videos during, COVID and, hey, look at this funny puppy video, or hey, look at that. And, as I started kind of becoming more familiar with it, I would scroll the FYP and I was seeing some mental health content, but I was noticing that, a lot of it was not from licensed professionals and was not necessarily accurate. So I thought to myself, like, hey, I have some, time to spare, during COVID. So, maybe I'll get on, maybe I'll do a couple educational videos and see what people want to hear about. And, maybe hopefully also make this the topic of mental health a safer one, and for also people to know, because I would also see a lot of comments of people saying like I was poorly treated in this setting or in that setting, but also to let people know that there are mental health creators out there who care, who won't act like some of the horrific stories that I was seeing. I won't kind of go through the whole thing again, but yeah, that's kind of how I got my start on TikTok. And after one of my videos had kind of went like semi-viral, and then I was saying like, wow, people actually want to listen to maybe something I have to say. And that was very surreal to me. And then I guess it just started going from there.
That's awesome. That's awesome. And so when I scroll through your content, I find a lot of interesting videos that tailor to Gen A and Gen Z.
Mm-hmm.
And I pride myself on knowing teenagers and kids and feeling like I'm a kid, but I always get confused. And I wonder if the audience too is about like, what's the discrepancy? Where the age set-offs. Could you tell us, like, what age is Gen what, or when does millennials become millennials, just so that we have an understanding before we get into the deeper parts of that?
Absolutely. So Gen Z starts at anybody born in 1995 all the way up until 2009. And then Gen A starts from 2010 until 2024. But I always tell people there's not a distinct cutoff. You know, there's a lot of overlap between younger millennials and older Gen Z, and there's a lot of overlap between younger Gen Z and older Gen Alpha. So it's not a specific cutoff, and we even see some of like those characteristics start to blend together as you see. I call them the hybrids. When you see like the younger Gen Z and the older Gen A, they kind of like resemble each other a little bit.
I see. Okay, okay. So when I'm thinking about kind of like from my child psychiatry standpoint, is that, if I have a Gen Air, I'm thinking like probably mid 20s, or something, maybe like late teens, early 20s, that I'm kind of like seeing, in kind of like thinking of in terms of like developmental status. Like that's where I need to be thinking about, or chronologically age. But my teens and my young, preteens, that's going to be my Gen A population, and that's what I need to kind of be thinking about. So that's helpful to, and I will now not forget that. That's really important. But that being said, how do you find some of your mental health TikTok videos? Do they when you're thinking about a Gen A population watching or a Gen Z population watching, do you tailor your videos differently?
I would say yes, I do. I mean, I am well under the assumption that, Gen Ayers are not necessarily going to be finding my videos because they're probably not on my side of TikTok. So really when I talk about Gen A, I'm talking a lot to the parents, to the grandparents, the aunts and uncles of Gen Ayers. Gen Z is a little bit different. I do get a lot of, Gen Z watching my video and, watching in my comments, but also those videos I started out specifically making them for older generations because I was just seeing so many people just bashing on them. And I'm going, well, hold on, you guys have no idea what they're capable of. And you have no idea like what I see every day. So that's really kind of why I started talking about them. So some of my videos, yes, do tailor to them, and it has to do in more of an activist way. Like, hey, let's get together and work on this, or I need your help with this. Let's sign this petition. But it's also, when I'm talking to Gen Z, it's very much also trying to reassure them too that they have a place and that they are incredible, and not to forget how incredible they are, and not letting older generations basically like punch down on them for one reason or another. So when I do tailor my content specifically to those generations, it really is for kind of an uplifting purpose, because quite a lot of times you when you talk to them, they feel alone, or they feel like nobody understands them.
Absolutely. And I invite anybody on that Psych NP's TikTok or My Media's Psych's TikTok to leave a question or a comment. Harridan on my side said, "Never understood the bashing of the younger generations. I want their lives to be better." And that sounds like what you're talking about. That Gen Z is just kind of this group of individuals that have kind of taken on different things, such as like climate change, and like being in what they call quintessentially the fire age now, or like the difficulty with inflation and difficulty with the housing market, all of these things, right? And so we are talking about kind of grieving and empathizing with those, versus the Gen A, which is parent management almost, and like how do you talk to your child, and how do you talk to your younger teen about these things?
Absolutely. Absolutely.
Excellent. And I'm going to tell again, if you're just joining us right now, my name is Dr. Ashwin Sood. I'm with Laura, who is a psychiatric nurse practitioner, as well as a licensed clinical social worker, as well as a prominent social media figure. We're here on Divergent Minds, discussing and talking mental health, TikTok, and Gen Z, Gen A, and what how we talk to these types of audiences, what these audiences are, what are the problems they're facing.
And I was actually going to use this as a transition point for, I see kids and teens and young adults all the time in clinical care. But when I see young kids and teens, they're facing all different types of things. And so for Gen A, when you talk and give, education and recommendations, obviously, it's more of like, this is education and not like clinical guidelines I'm giving you to use personally. But when you tell parents this, what are the things you're often recommending or teaching them or saying, hey, look into this more?
In terms of, especially when I talk about Gen A, I'm always talking about their empathy. And I think that's something that's really shining through in terms of their generation. And Gen Z, very much so, yes, they have a ton of empathy, and that's why they are working to change so many things, and why they're so active. But with Gen Alpha parents, I'm really just expressing to them how important it is to be role models in terms of that empathy, how to teach it to them, how to teach them how to recognize other people's emotions. And if you just start out, and it doesn't, even if you start out now when they're a little bit older, it still could be done. But, being able to recognize what somebody else could be feeling potentially, and then how that might feel. That, I think, has been the biggest game changer almost, for this generation, because it's promoting them to help each other more, to work together, to stand up for each other, to stand up for what they feel is right. And they have a really good sense of like moral character most times. I can't say all times, but so that empathy part, it's very simple, in terms of having parents just role model that for their kids. Hey, I've often said, like, I sit with my daughter on the couch, we're watching a movie, and if a character's crying, I say, what do you think that character is feeling right now? And, she'll say sad. And I'll say, well, why do you think she's feeling sad? Oh, well, because her friend got mad at her, what. So this way she starts to kind of see those cues in others in public. And then because of the fact that they are in front of screens so much, teaching that empathy, teaching that emotion recognition, it kind of pulls them to people more instead of, really just staying behind those screens.
Yeah, so that actually is, screen time, right? That is a big, prior to the pandemic and prior to, TikTok and Snapchat and everything becoming so quick and easy to jump on the screens. The American Academy of Pediatrics would say less than 2 hours a day, that we would kind of just really quantify. But now all of it is all really about quality. Like, what are you consuming? Because everyone's consuming, something on the screen. So how do you, I'm asking a lot of these questions because we, Dr. Chapman and I are always in this conversation with each other. Like, how do we guide parents about screen time? And Divergent Minds is a lot about that. Like, what are the right questions to ask? So when you talk about with your daughter or with your patients or just in general, do you have like a starting point of saying like, parents, what's the step if a parent comes to you and says, my kid's on their iPhone too much, what's your first step in talking to them about that?
I always am a big believer in just assess, gathering as much information as possible, because I never think it's as simple as, well, that's too much time, put it down, or that behavior is not good. It's a function of something. There's a reason why the behavior is occurring. If you, in talking and assessing what's going on, you may sometimes find out that they are on their phone a lot because they are anxious because there's some bullies at school and they, want to make sure that their information isn't being put online or anything embarrassing isn't being shared. Are they on it because they have issues with social skills and they don't necessarily know how to relate to somebody in person, but they're much more comfortable behind the screen? So I think it does depend on why this behavior is occurring. Where's the screen time coming from? Yes, we all like to look at screens, but if we think about it, there's a reason why we all do it. So I think that we can really tailor a really good answer by just getting as much information as possible. When does your child seem to be going for the screen? How long do they seem to be on it? What's their mood like before and what's it like after? And then start getting those kinds of questions answered, so this way we can maybe get some insight as to what's happening. taking the screens away is just a band-aid, or giving screens is just a band-aid. There is something usually behind it or underneath it that should be and can be addressed.
Absolutely. I mean, I think about that all the time, right? Kids crying, throw them a screen, and you're just like, please make this crying go away. Or they're throwing a tantrum when the screen is taken away, and you give it right back, right? And we're all guilty of it as parents because it's hard to do that at 2 a.m. or 3 a.m. at night or something of that nature, right? So it's collectively really difficult. Much easier said than done.
Right. I think my daughter's on her iPad now, so this way, like, she doesn't come and interrupt me doing this.
Yeah, exactly, right? You're just like, oh my gosh, how do we
minute?
we're all doing it, right? So yeah, it's critical consumption too, I think is important. And one of the things we also deal with, both I think you and I, is how do we set boundaries about these things? And so is there a way in maybe with your daughter or with some of your patients, do you teach of like, if a parent comes to you and is like, listen, it's cat's out of the bag, they're using their iPad all the time and they can't stop playing, like, you know, the equivalent of yesterday's Candy Crush, right? Like, what do I do? How do I stop them? Like, what do you, after you do your assessment and you find that, you know, let's take a clinical example, you know, they're doing it because doing so makes them feel good about themselves because they don't want to do their homework or they're not understanding it and it feels overwhelming to do their homework, so they're distracted by their game and then they can't stop playing their game. How do you approach that type of situation in terms of setting a boundary? And I'm asking you a loaded question here.
Sure. Yeah, no, and it's a good question. It's a good question because a lot of parents have that question. I am always a fan, and I think this is kind of where I bring my LCSW into the picture as well, as, you know, pending there's no depression going on, pending there's no, you know, nothing going on that, you know, clinically needs to be addressed. Let's kind of just say this is, I don't want to say run of the mill poor self-esteem, because poor self-esteem is still something that we don't want. Kids understand more than we give them credit for, and especially kids now. So I never feel it's completely helpful just to set a limit, not explain why, and just keep it moving. But to come to the table quite literally with your child and say, hey, look, let's sit down together. Let's talk about this. So, you know, you're using the screens more because, you know, you don't really feel that great about yourself. Okay, so let's talk about how can we get you feeling really good about yourself? Not just because of the screen stuff, but because I want you feeling happy and I love you. I want you feeling good about yourself. And then the more it's a joint effort, the more buy-in you're going to get from the kid and the more follow through. If they are a part of that plan, that makes all the difference. Sometimes as parents, we do need to just kind of drop the hammer on some things. And yes, that is what it is. But for these kind of issues, I always think coming to the table with your child is a really good idea, because then they get to participate in it. And then they might be able to suggest, okay, well, sometimes playing soccer makes me feel good. Okay, great. Let's explore some like youth soccer teams in the area. Well, I think art makes me feel good sometimes. Okay, so maybe let's run out tomorrow and, you know, grab you some like art supplies. So they're an important part of that conversation too. So coming together with them and having them be a part of the plan, it also gives them a lot of sense of self-control. And I think that's what we're also seeing as like a problem with these younger generations, is a lot of times they feel a lack of self-control or a lack of a sense of control, because they see all this craziness going on in the world and they know it's crazy and they feel that they can't do a damn thing about it.
That nails it right on the head. We often talk that teens want two things: a sense of feeling feeling accepted, and a sense of agency, an ability to have control over your own destiny. It's not that they want you to overlook, or it's not that looking over their shoulder is not just a privacy issue. It means that they can't control what they consume. You're controlling their consumption. That is really important from a developmental standpoint, right? Because teens are exploring the world. They're obviously having risk-taking behaviors because that is what they are, right? That is how we have evolved. And so it goes right into it. So agency and competency are two important things parents need to be kind of aware of. Before I go on, I just want to quickly let our viewers know, my name is Dr. Ashwin Sood. This is Laura, that's Psych NP, a psychiatric nurse practitioner and licensed clinical social worker who has graced us with her presence today and is continuing to teach us so much about the social media world, as well as Gen A and Gen Z. We're Divergent Minds, a weekly podcast that is shared on Facebook, but we are making our break into TikTok and potentially going to get more wonderful co-hosts such as Laura to join us and talk about the intersectionality between social media, mental health, parenting, and all that fun stuff. Like us, follow us, do whatever you want, leave comments and questions, we will respond to them. So, all of that being said, one area of expertise that I always want to go into, or just a section that I love talking about, is misinformation and disinformation. It's rampant. It's all over the place. It's not just on TikTok. It's on Instagram. It's on Facebook or Meta. It's everywhere. And we as providers, physicians, nurse practitioners, PAs, whatever you name it, are often seeing this. And even our own colleagues have joined in on it sometimes. Have you seen misinformation about mental health on TikTok? And could you give some details? You don't have to detail who the people are, but like what the content looks like.
Sure. I think the thing that might kind of irk me the most, or one of the things I should say, is seeing these, and again, this is not to disparage or poke at anybody who is a life coach, but there are some life coaches here on this app that say things like, well, if you have anxiety, just get up and go do something. Or if you have depression, just kind of power through it and get up and go do something. You're in control. And, that would be great, right? That would be great. But the reason why people come to see us is sometimes it almost sounds a little bit ableist is what I've learned on this app. And that's why I love this app, because I'm always learning too. That's kind of like an ableist type of, idea that you can just power through it, or you can just, get outside and touch some grass. I'm always hearing, and people would love to do that if they could, but they can't do that. A lot of people can't do that. So I think those kind of messages really end up hurting people who are having significant mental health issues, or even moderate mental health issues, that, oh, look, it's just this easy. All you have to do is, just go outside and be in the sun for a while, get that vitamin D that everybody, and then, I can't do it. So then how bad must I be? Like, how severe must I be? I must really be bad if I can't do that. I see also a lot of like, you don't need medication. Medication is all bad. They want to just throw pills at you for everything. And I would venture to say a vast majority of us prescribers are like, if we don't have to intervene with medicine, we don't. We really don't want to. That's always really the last resort. Or it's a piece of the pie puzzle. It's not just meds. We need to kind of address the whole issue going on. So I think those are kind of the biggest things that kind of irk me. And I definitely do a lot of, instead of call outs, call ins, to kind of explain to people, hey, look, it's not that easy. We can't just tell people to just go outside and they'll feel better. We shouldn't be doing that. And then also it's issues can be so complicated that we can't just make blanket statements such as no medication is good and medication should never be used. I think kind of the one that's pressing the most right now that I'm seeing a lot of and that I'm talking about the most is the whole concept, and this kind of ventures into the political area, which I understand if you don't want to go there, but the whole idea that LGBTQ issues are mental health issues, or that transgender is mental health issues. And I have to scream it from the rooftops that It is not. And people don't believe me, but that's kind of the biggest misinformation I think I'm seeing now, given the political sphere, is that it's a mental health disorder, and it's not.
Aren't we kind of then falling back into the DSM diagnoses that were ripped out because
Yep.
we realized that
Yep. The amount of videos I've had to do to explain why gender dysphoria is not gender identity disorder is, I mean, the amount of times people I've had to explain that to, it's crazy. But yeah, I think I think it's the most dangerous one out there right now is what I will say. And a lot of them are dangerous, but I think that could be the most dangerous and harmful, or at least at the top.
yeah. It's very, you speak on. I often am asked on here, what do you think about Jordan Peterson? What do you think about Jordan Peterson? Immediately, like that's one of the biggest questions I always get asked, and maybe that might be because I'm like a male therapist on TikTok, and I don't know why, but I tell people immediately, listen, I'm not going to comment on one way or not. I want you to comment on the social media aspect of all of this. Social media is polarizing. It's going to push you in one way or the other. The algorithm is going to tell you to look at one thing or the next. Not because that's what you want, it's because the algorithm thinks you want this.
Right.
So you got to be really careful and see, including myself, you have to be very critical in what you consume. Mm-hmm. Look at the overall content. Look at all of this. Think about how, you consume the data in what you're consuming. And social media is sound bites. And so one person might say something about the LGBTQ and mental health. You'll look at it, and then you'll all of a sudden start seeing all of these people saying the same thing, like LGBTQ, isn't that a mental health disorder? Aren't those individuals all have mental health disorders, right? And it becomes a very, very kind of big echoing chamber, which is really dangerous for people. That is like really, really kind of, for Gen A, for example, or early Gen Z, don't know what to consume. All of a sudden, they're just getting showered with tons of this information. And so this is why, it's important for people, individuals like you, to highlight the nuances behind it. And I talk about all of this too because, and I just want to look at the time. We're slowly almost getting out of time here, but I just want to also talk about that too because there is people may not understand, but mental health practitioners have to go to advanced graduate levels of education. You got your licensed clinical social work, right? So that means you had multiple clinical hours you had to put in as a social worker. And you did your, advanced psychiatric nurse practitioner degree, and then a psychiatric board certification in psychiatric nurse. Those are years and years and years and years, right? And so that just teaches you mental health is incredibly nuanced.
Oh yeah, and it changes
overnight.
Mm-hmm. It changes as we learn more, and our ideas change, and the way that we, the professionals in the field, think about things change too. So, it's science is always evolving, and that's, I think, what a lot of people do forget.
Absolutely. Mm-hmm. I think we're getting to the very end, and here on Divergent Minds, we often, Dr. Chapman joined, and he wants to be invited, and I want to invite him, but I don't know if that'll knock you off. And I think we'd all appreciate to keep you on for an extra 2 minutes. I see him all the time. But we can see if we can get him on with our next guest. But hey, no, I want to watch it. There he goes. One thing I wanted to ask you, and we do this on Divergent Minds, is we ask, what can we leave the audience with that they can practice this week from a mental health perspective regarding the content that we've talked about, like something that they can kind of maybe use as a little bit of like cognitive homework that you would think might be kind of easy to do, 5-10 minutes. And if you don't have one, I've got one in the back pocket if you're thinking about one.
Sure. In terms of a specific exercise, I don't have one right now, aside from kind of simple mindfulness stuff, either I always go 5 senses, look around you and, what do you see? name something you can hear and listen to that, name something you can smell and listen, and smell that. So I like to do that. It's very grounding for people. And it's something I have a lot of my clients do who, just can really get themselves worked up, or if they, dissociate or get anxious. It's, also very helpful for people with trauma.
Yeah. Fantastic. I love that. Let's end it on that. That is a good one to end it on. Thank you all for coming to Divergent Minds. My name is Dr. Ashwin Sood. I'm with Laura, our wonderful co-host today. She is a licensed clinical social worker, psychiatric nurse practitioner. See, I think I've got it down now. And TikTok extraordinaire, that's PsychNP. Please follow her. She's great. Her content's fantastic, focusing on Gen A and Gen Z. A great mental health provider to have on here. If you'd like to follow us and learn more about us, follow us at TreffertStudios.com. You can follow the link right in our Mind Media site. It's the first link under the link tree if you click it. But otherwise, we're here every Wednesday, 12:15 to 12:45 Eastern Standard Time, or we'll be on Facebook Live at Treffert Studios.
I think you're 1:15 to 1:45 Eastern Standard Time.
Thanks so much. I always do these time zones. She corrected me. Yes. The Wisconsin page is at 12:15, 12:45 Central Standard Time, but our shows are on the Eastern Standard Time, 1:15 to 1:45. Same times. All right, guys?
And thank you for having me on. And if you need somebody to come on again, this was so much fun. I'd love to. So please reach out to me if there's anything else, you want to discuss, or this was a lot of fun, and I enjoy talking about this.
Thank you so much, Laura. You have a wonderful day.
You too. Thank you. All right. Bye.